Here's a thing I've been thinking about many times without really having a good answer, and as per usual, I will from now on provide the necessary comment to please YouTube, and that is, you should always seek out a professional when regards to anything health related. So, is it difficult to get the proper treatment? In my opinion, yeah. And the constant problem, at least here in Sweden, and this doesn't just relate to only to a mental health problem. It relates to all kind of medical things, normal physical problems as well. It is the first thing you face, and that is the first meeting with a doctor or a physician or something. Sometimes it's quote unquote just a nurse, and I mean just because, yeah, it is the first instance to evaluate you, the triage, This instance is problematic. Sure, a lot of people get estimated and diagnosed, the preliminary diagnosis you get there, correctly. The assessment done there is in many cases done correctly, but it is also in many cases done incorrectly. Because the people sitting there have they have two jobs. Their first and primary job is to help people, to provide health care, to make sure that people who come to the hospital receives care, the care they need. The second part is people who come there sometimes don't need health care. So they are there to, weed them out, to make them go to the right place, which is sometimes just go home again. So, and this is done for, obvious resource-ish things, because there's a limited amount of resources to provide healthcare. And this is not really a debate about universal healthcare versus private healthcare. I've often heard that it's easier to get the correct assessment in private healthcare versus universal because, well, you basically pay for your way in to get to the real place where you get the real diagnosis and so on. In the universal healthcare system, you actually face this wall. There's no easy way of putting it otherwise. It is a wall where their job is to evaluate if you even need help. And in this thing, there's also the time limit. It is calculated a 15-minute window. So that means your healthcare provider has 15 minutes to diagnose you with a preliminary diagnosis that is about, should we even take you in? So imagine going to the emergency room for psychiatric conditions and wanting help. People who go there are two types of people. They are people who are forced there by their loved ones, or they are people there that are afraid and really want to be helped. But in my experience, 90% of people who really should go to get help don't. They sit home and they just either go through the the bad spell, or they just continue struggling with it, or even, don't and succumb to it. And I know, I worked in this, that a lot of people who come and seek help, they don't get the correct help. They do in the second place of the, system, when they have crossed the wall and entered the hospital system. Then you get, very much often so, the correct healthcare. The problem is this first instance. I don't like to bad mouth this universal healthcare system we have here. Now, I don't know whether it's unique to that, but it's a simple fact. The first instance of the Swedish healthcare system sucks. And it doesn't suck because the people sitting there aren't competent. It doesn't suck because the people there can't help you. It sucks because they work in a system of time limits and restrictions on how much effort they can put into something. And when it comes to something like vague physical symptoms, that often leads you to a long, complicated battle to find the right diagnose and so on. And it's the same with psychiatric conditions. The problem with psychiatric conditions is that they are very often very vague to define, and it weighs solely on you as the patient. If you go into a doctor's office with a physical ailment, the doctor can do tests, and he can look at, the lab results and measure things and look at x-rays and so on, and hey, I know what's wrong, I found it there, and pointing at something. Psychiatric diseases doesn't work like that. Psychiatric diseases and conditions need you as the person seeking help to verbalize the right things, and that is hard. Imagine being completely fine, feeling completely well, and having to define something that is in your mind. It's real, but it's in your mind. It's your mind that's broken. That's really hard. Now, imagine doing this while also being under the influence of your condition, perhaps including also other things that is a result of this, like depression, like panic. These things influence how you communicate. You can also be in a slightly catatonic or, defensive position where you don't really speak about things. There's a lot of things that influence how you verbalize, how you communicate your problem. And through this, in 15 minutes, you're supposed to get a diagnosis. It doesn't work. There's no easy way of putting it. It simply doesn't work. You can't get a good preliminary diagnosis in 15 minutes unless something is a textbook example, and it rarely is. When you work in the field of medicine, you encounter people that struggle with telling the story of what is wrong, why they are there. They can focus on completely irrelevant things, and you end up getting the relevant data like 15 minutes in, close to the time when the meeting is supposed to be ended and over. And by then, it is too late. And what I mean by too late, studies have proven that people who go and seek any form of medical help, this is both the same with physical and mental ailments, they get a preliminary diagnosis within like 1 minute. The doctor or whoever examines you is very quick to assume and, look at things. And sometimes it's the words you chose when you rang in and said, "Hey, can I come and see you? I need to have this checked." Then in that very moment, they read up on you before entering the room. They already have decided what's wrong. That's a simple fact. That's how humans work. Humans work like that. We make an assumption based on the data we get very quick. And the problem is we also tend to be doing this faster and faster the better we get at things. And the problem with this is we get blind and we don't see when people are talking about things that are irrelevant, really. Like the person completely comes in, complains a lot about feeling very depressed, feeling very, very low. And not until the very end of the session does he mention things like, "Oh, I struggle with a sense of self. I struggle with mood stability," and so on. Quite relevant variables that might hint you from, hey, maybe this isn't a depression. Maybe this isn't the patient seeking help for depression. But that is what he's feeling. That is the main problem. The real problem is this patient might suffer from borderline, bipolar, or something other that can cause a lot of problems with depression. And you have that in the background, but it's expressed later on because the physician listens too much about the first things that the patient tells, the patient mentions. This is a big problem, and the healthcare system is aware of it, but they really don't do anything about it because, on the other hand, there is this notion that things should go rapidly, things should go fast, and we can't really be bothered to give more than 15 minutes with each patient. And in 99% of the time, it's okay, and the patient gets the correct assessment instantly because they have obvious things going on for them. But with thousands of patients seeking help daily, 1% is still hundreds. Hundreds that get the wrong diagnosis. And in some cases it doesn't matter because things resolve on their own, or the incorrect diagnosis has a treatment that accidentally also helps with your condition. But in my own case, I remember this, I sought help for my condition, it was like 13 years ago, and I was solely focused on the things that bothered me, which were depression and panic. I had panic attacks, and I actually had one at the doctor's office. And he was just, bothered by me being a very stressful and, difficult patient in that manner. And since I sought help with depression, he said, "Well, you have depression, so here's some antidepressive pills." And sure, those things soothed out some of the symptoms, but in no way was it a treatment. And in no way did it give me the tools to become better. On the contrary, I fell slowly and steadily into worse and worse places in life because I got diagnosed incorrectly, because the doctor didn't analyze me correctly. He didn't listen to what I said correctly. He just listened to the first things I said. So this is a problem. This is a big problem, and doesn't seem to be any real way to fix this in practice. In theory, it is simple. Force the medical system to give more time with each patient, even the quiet or difficult ones, or those who verbalize the incorrect, variables for a correct diagnosis and so on. And especially, this is important with anything regarded to mental health. But hey, here we are, and there's a limited amount of resources, and it is frustrating. It really is. So, do I have a solution to this? Of course not. I don't. More resources, more money. It usually is the thing. But we also need a fundamental attitude change everywhere. And yeah, the universal healthcare system, in all its superiority, morally wise, towards the private system, has some nasty practical side effects like this. The wall, as I call it, the wall you bounce on when you seek help, if you don't say the right things, if you don't know how to manipulate the wall, and so on. A bit of a rant, but I think it's an important thing, and I would love to hear how it is in your country. Do you have a similar experience of this wall? And how is it working I'm especially interested, how easily is it to get the first proper, thorough help when you seek help in your country, especially if you live in a system with a private healthcare system? I would like to know that. It would be interesting. What I've heard is that if you have good insurance, then you will get good first help. But yeah, I'm not sure about that. I'm pretty sure there's a time limit in each system where each doctor is supposed to do things within a certain amount of time, but I'm not certain. So anyways, it's a bit chilly here in good old Sweden. It's not warm, and yeah, slow days, easy days here. Let me know how you're doing.